Long story short, Ozempic and Mounjaro and drugs like these, they mimic the actions of incretin. So what's incretin? Well, incretin is a naturally found gut hormone, which increases insulin production and slows down gastric emptying, so your stomach remains full for longer, which generally means you eat less because you're constantly full. It acts on receptors in the part of the brain that regulates how hungry you are, called the hypothalamus. This triggers feelings of feeling full all the time and also reduces what's commonly known as food noise. Currently, GLP-1 receptor agonists are free on the NHS for those with type 2 diabetes, and secondly, for those with obesity, which is a BMI of 35 or more with at least one weight-related comorbidity, such as high blood pressure or heart disease. But outside of the NHS, there's roughly about 1.5 million people paying for these injections. That can cost anywhere between 150 to 300 pounds every month. So what did the studies actually show? Well, there were two main trials, one called the SUSTAIN trial for those with type 2 diabetes and also the STEP trial for those with obesity. Depending on the type of drug, trials showed that you can lose roughly between 10 to 25% of body weight in about a year. Most of this weight loss happens in the first 3 to 6 months, where then you start to see a plateau effect after the first 6 months. In the US, these medications received FDA approval in 2015. And then when we hit around the mid-2020s, lots of counterfeit drugs flooded the market with their own side effects. So of the pure drugs, what are the actual side effects seen in clinical trials? Here goes. Firstly, gastrointestinal side effects, such as nausea, vomiting, and diarrhea, were pretty common, seen in roughly about 60 to 70% of patients on them. While side effects such as pancreatitis or intestinal obstruction were a lot rarer. It should be noted, however, that most of the GI side effects can be mitigated by a gradual dose increase. Other side effects include hair loss and muscle loss. But what are the downsides that nobody talks about?